to Udeozor's next chapter. In our latest segment here, I am very proud to say that we have Charlotte Dixon Burke. She is a registered nurse, a nurse advisor for the Sickle Cell Disease Foundation of Southern California. So we're going to talk a little bit about this very important topic for nurses of sickle cell disease. Miss Charlotte, can you tell our viewers exactly what sickle cell anemia disease is and who it affects?
Sickle cell disease is an inherited blood disorder that affects the red blood cells in our system. Red blood cells carry hemoglobin, which is the oxygen carrying protein that is in the red blood cell. I say that to say it's very important because without the oxygen carrying red blood cell, the cells then sickle, and that is what causes the pain in sickle cell disease. So it's an inherited disease that you have to have two genes from each parent that was abnormal.
Okay. Tell us about the trends in the populations of who this disease affects.
This disease, the public believes that this is an African American disease. It is primarily African American disease, but people with Latin ancestry, and the people in the Caribbean, people in the Mediterranean, people in Asia, people in India, can all have a form of sickle cell disease. But it is primarily an African American disease.
Okay. Can you tell us about genetic trends in childbearing for couples who maybe have sickle cell trait and what they need to do before they conceive?
All couples who are considering having a family together should go through genetic counseling. They will go through genetic counseling, and one of the things that would happen in genetic counseling is that the geneticist would order a hemoglobin electrophoresis. Hemoglobin electrophoresis is a simple blood test that will let them know what their trait status is. If they carry a trait, what kind of trait they carry, and if they don't carry a trait. With each pregnancy, and I have to emphasize with each pregnancy, that these two people have together, that baby could be affected with sickle cell disease or sickle cell trait, because one parent can pass on A, which is normal hemoglobin, and the other parent can pass on the S, which would have been the abnormal or the sickle hemoglobin.
Okay.
So say family has, mom is AA, which is normal hemoglobin, dad is AS, which is a sickle cell trait.
Okay.
That baby has a chance of having a sickle cell trait because now they can inherit one normal, one abnormal. But say one parent has sickle cell disease and one parent has a sickle cell trait. There's a 25% chance in each pregnancy that that baby would have normal AA hemoglobin. There's also a 25% chance in each pregnancy that that baby could have sickle cell disease. There's a 50% chance in each pregnancy that that baby would have a sickle cell trait. So when I have to keep emphasizing with each pregnancy. Okay, so couples can't assume that because now we may have a child who has AA hemoglobin.
Which is normal.
Which is normal. That next pregnancy could possibly produce a child with sickle cell trait or disease.
It's like a gamble.
It is a roll of the dice with each pregnancy, and no one can predict for you in whichever pregnancy this is, 1, 2, 3, or 4, how that baby is going to be affected. No one can predict for you. It's a roll of the dice with each pregnancy.
Can you explain the difference between the trait and the disease? A person who has sickle cell trait and a person who has the actual disease.
Persons who have sickle cell trait normally do not have symptoms or problems with their trait status.
Okay.
Now, in a high stressful situation, they go mountain climbing at a high altitude, or they're stressed out either playing football or some strenuous sport. They may have blood in their urine or have some problems with pain like sickle cell disease patients do. That's not normal, but it can happen. Most patients with trait have no symptoms and no problems.
Okay.
But they carry the trait, and they have to be aware of their trait status when they decide to start a family.
Okay.
Sickle cell disease patients, though, can have multiple issues with their sickle cell disease and symptoms, pain being the one that they present most with. But they can have problems with the brain because you can sickle any place in your body.
Mm.
Vaso-occlusive episode, which is what happens when people have pain episodes. But that vaso-occlusive episode can happen in any organ in your body. It can be your brain, your heart, your lungs, any place you can have a sickle cell episode.
Mm. Can you give us a picture of that pathophysiology, of that vasoconstriction and that sickle cell, and tell us why it's so painful?
It is so painful because as the red blood cell circulates in your body,
Mm-hmm.
it normally carries oxygen.
Mm-hmm.
But remember, in sickle cell patients, they have a sickle hemoglobin which does not carry oxygen. So say we've got blood that's traveling to an arm,
Mm-hmm.
down an arm into a hand,
Mm-hmm.
gets to the elbow, and at the elbow, what happens is that normal red blood cell, which is cushy, looks like a donut, can
Mhm.
pass through blood vessels.
Mm-hmm.
Where that sickle cell looks like a banana or actually has a sickle shape,
Mm.
blocks that normal red blood cell that is trying to conform and pass through, but that sickle cell now is blocked, and it's called a logjam effect.
Okay.
Say it stops here at my elbow. Those oxygen carrying cells, red blood cells, now cannot get to my hand.
Mm.
So when oxygen cannot get to different tissues, there's a little bit of tissue death that happens each time.
Mm-hmm.
Now over time that causes organ damage,
Mm-hmm.
but each time it causes pain because
Mhm.
now you don't have oxygenated red blood cells going to my hand.
Mm.
So my hand is going to hurt,
Okay.
or my arm is going to hurt, or my leg is going to hurt, or my back is going to hurt. Wherever those cells are blocking the regular cells from getting where they need to go,
Mm-hmm.
that's going to cause pain.
And this is what we call sickle cell crisis.
This is what
correct?
you call sickle cell crisis or sickle cell episode.
Okay. I'm so happy that Charlotte brought up pain. I have been following some sickle cell patients actually on social media just to get an idea of what a day in the life of a sickle cell patient is like. They're very sharing, they're very generous, they're very strong. They actually got together and decided to get some quotes together for me. So I have one and I wanted to read it and see what Charlotte thinks and see what we can do as nurses. So I'm so happy that you brought up the subject of pain. I have been following some sickle cell patients and I've actually got an actual quote here that deals with pain, and they have a message for us as nurses and to all the medical professionals. So I'll go ahead and read that quote. Professionals need to know that me and most other sickle cell patients are not drug seekers. I know that by the time I make the decision to go to the ER, I have been suffering from pain that cannot be measured on a scale of 1 to 10. And to be looked at as a drug seeker when I tell them what usually works for me after being asked is a huge slap in the face. So that's disheartening. What can we do better, Charlotte?
That is a disheartening statement coming from one sickle cell patient. But that is the norm that most sickle cell patients will report to you. Because what we've done in the medical community is put them in a situation where when they present to us, we don't believe what they're saying. Now, in nursing school and in my nursing practice, I have been taught that pain is whatever the reporting
patient
person
says.
it is.
Mm-hmm.
If you say you hurt, it is my job to believe you hurt when you tell me that you hurt. Not understand that you're a sickle cell patient. And I've heard somewhere down the line that all sickle cell patients are drug seeking. So I'm not going to give you drugs, but make you sit in a waiting room for 6 hours.
Mm-hmm.
Most sickle cell patients will tell you that the last place they want to be is our emergency room.
Mm-hmm.
They have done everything that they need to do or know to do at home before they come to us, because what they have been taught, their experience is when they come to us, we're not going to believe they're in pain. We're going to make them wait for the pain medication, because somewhere out there in the atmosphere, somebody said all sickle cell patients are drug seeking. Well, if you read the literature, 80% of sickle cell patients do fine and are not. The 20% that you see are the ones who may be drug seeking, but it's not my place to say that.
Mm-hmm.
When they present, drug seeking is the last thing that should be on my mind as a nurse.
Okay.
As a nurse, my first job is to make sure if you come in with a complaint of pain, my job is to get your pain treated. It's not my job to make any kind of assumption about you or listen to what somebody may be. It's just that sickle cell patient or just that sickle, which is horrible. Our job as nurses is to take care of that patient's complaint. Everything else needs to go out the window. And that's just not nurses. That is all medical professionals who come in contact with these patients.
I
It's our
agree.
job.
Absolutely. So, sickle cell community in America and across the world, we've noted your concerns. I'm going to make sure that we do better. I thank you so much, Charlotte, and I want to thank Mary and the entire Sickle Cell Disease Foundation of California. That's it for this episode of Udeozor's Next Chapter.